All right, well, it's noon and we're excited to be here today. Thank you all for joining us for our lunchtime chats. All right, well, it's noon and we're excited to be here today. Thank you all for joining. Sorry, I got feedback there. So thank you for joining us for our lunchtime chats with Tlingit Haida. My name is Richard Peterson, and I serve as the president of Tlingit Haida. Today, I'm excited to have with us again SEARHC's Chief Medical Officer and Senior Vice President, Dr. Elliot Bruhl. This is, I think, our third time, Dr. Bruhl, and he's been fantastic in helping us provide you all with updates on the coronavirus pandemic, how it relates to Southeast Alaska as a whole, vaccines. We'll talk about the Omicron variant, post-COVID-19 conditions, and answer any questions you might have. His presentation will address the status of the pandemic and the importance of staying safe and getting vaccinated. Dr. Bruhl, thank you so much again for joining us. Do you want to introduce yourself to our guests?
Thank you, President Peterson. It's an honor to return and have an opportunity to share information with you. My traditional introduction, I'm learning and ask your forgiveness for any mispronunciation or errors. Kaidake, Yuhat Duasalk, Luchnahari Hatsati, Gleka Ayahat, Shitka Kwan Ayahat. My adopted Tlingit name is Kaidake, and I'm a member of the Luchnahari clan in Sitka. I'm a family physician, been practicing medicine here in Southeast Alaska for the last 25 years, and I have the pleasure and the honor of leading our medical staff at SEARHC throughout the Southeast Alaska region. And as I said earlier, it's a pleasure to come back and share some information with all of you. Let's see if we can move to the, anyway.
But look, if I can, before we get started with your presentation, Dr. Bruhl, and forgive me, I really just wanted to take a moment and to give us a moment of gratitude to SEARHC and its leadership for partnering with us to ensure our tribal citizens are receiving accurate information on the coronavirus vaccine. As we know, there's so many different views and claims about coronavirus in the news and on social media right now. And, you know, my feeling is misinformation risks undermining public health efforts. And it's important that our tribal citizens have the facts when they make the decisions on whether or not they're going to vaccine or not. So, you know, we're so grateful to SEARHC for working with us to provide opportunities also for our employees to get vaccinated. We've been doing every week, they've been coming to 2 locations here in Juneau to make sure our folks are tested, and then also giving them the vaccine if they haven't already. So that's been just such a great collaboration. So I wanted to take some time to recognize that and how important that's been. You know, we hope this presentation will help relieve any anxiety you have and allow you to make informed decisions with up-to-date and accurate information. And I know that I have found Dr. Bruhl's presentations to be extremely helpful in my efforts to help educate people and myself. And so, Dr. Bruhl, we thank you so much for continuing to join us and do these. So if you're ready, go ahead, please feel free to begin your presentation.
Thank you again, President Peterson. And as I said, it's an honor. And I on behalf of our 1,400 employees who have all been working so terrifically hard these last 2 years, thank you for acknowledging their hard work, and it's a pleasure to work together on this and other projects that we've worked together on. So we'll talk about COVID-19 here today, and I am going to talk a little bit about our current situation in Southeast Alaska, in our communities, as well as the broader context of of Alaska and what's been going on with the pandemic. I'm going to review some of the basic information about the vaccination, how it works, and some of that ground has been covered in previous presentations that I've made over noon hour. And so I'm going to move fairly quickly through that, but that doesn't mean I can't come back to it with questions and answers. Then we're going to speak as well about what is available and known about the Omicron variant, and we'll talk generally about variants and mutations. And then also lastly, we'll talk about long COVID and some of the longer term consequences of COVID infection, which should help to motivate all of us to stay healthy as healthy as possible. So next slide. This graph shows October positive cases that SEARHC has recorded in all of our various communities where we provide care. And you can see that there are waves, and the orange here is Juneau, and this robin egg blue with this very high peak here in mid-October has been Sitka. And you can see that we've been having or seeing outbreaks at all of our communities at low levels. And there was a fairly substantial number in Haines a little bit earlier in September. And you can see some of our smallest communities have also had anywhere from 2 to 4 cases. Next slide. These are positive cases by week in the month of November, and blue is Juneau and orange is Sitka, which are the 2 largest communities where we provide care. And you can see that the levels have been generally falling in Juneau and kind of oscillating at a low level in Sitka this last month. Next. This is from the State of Alaska webpage this week, and you can see here the red indicates cases in Alaska from throughout the fall, basically starting at the 4th of July onward. And you can see we really went through quite a high level of cases in September and October. This month has been seeing a fall in the number of cases. That is a trend overall in Alaska that's been occurring in the last 3 to 4 weeks. Currently, in the state, we have about 80 people that are hospitalized with COVID, and we have had people hospitalized in both Sitka and Juneau. Next. This is a graph of Alaska Native Medical Center admissions for COVID and COVID-related issues. And you can see that where this starts in October and runs through the current time. And if we went back into September, these numbers would be even higher. So we have been on a very slowly descending limb of admissions at ANMC. This is a very important issue for us in providing care in our region, because Alaska Native Medical Center is an important referral center for our most complex patients. And when they're backed up, that means that we have to reach out into other areas of the state and region in terms of the care for seriously ill people. And at several points in September and August and early October, we found ourselves sending some of our tribal citizens to locations that are not our typical referral centers, but that was a matter of life or death and getting the care set up that people required. And in some cases, people ended up in the Valley, and other cases down south in the Pacific Northwest. At this point, we have, while things are busy at ANMC, there is capacity, and we've been able to send people there in the last couple weeks. Next. I'm going to talk a little bit about vaccines and how they work, side effects, current recommendations, and rates in our region of the state. Next. So the most common vaccines that we have are the Pfizer and Moderna. These are messenger RNA vaccines, and a fragment of RNA, which is genetic material, is injected into the muscle. The cells inside the body then read that piece of genetic material and produce spike proteins, which are identical to the proteins found on the outside of the virus. The body then reacts to those spike proteins and forms antibodies. And then when this individual who's been vaccinated receives a exposure to the real virus, they already have antibodies ready to attack it. And I think, as most people know, there's a person to be considered fully vaccinated receives 2 doses spread apart by 4 weeks. And we have some additional recommendations these days for people to receive additional boosters, and we'll get into that. Now, both the Moderna and the Pfizer work in this manner. Next slide. This is a slide that shows the manner in which the Johnson & Johnson vaccine works. What I would like you to understand here is that in the end, what results is the exact same thing that was occurring with the Moderna and the Pfizer, which is this little red protein, which is the spike protein, is produced by the target cell, and then the immune system is able to manufacture antibodies to that spike protein. In the case of Johnson & Johnson, it's delivered a little bit differently. So rather than injecting the messenger RNA, a fragment of DNA, which is encased inside a protein capsule from a cold virus, is injected into the muscle. Then the cold virus unloads that DNA into the cell. The DNA then works within the nucleus to manufacture the messenger RNA, and then the spike protein is produced. And then the immune system can attack the spike protein, and the person is immune because they have antibodies then to the spike protein. Next. A lot of concern all the time about side effects. Severe allergic reactions now occur about 8 times out of every 10 million doses. So it's a little less than 1 in a million. And we have not had anybody dying from these reactions in recent months because we're prepared and we know how to treat them. And so we have the medications on hand wherever we give these vaccines, and we're ready to treat that very, very rare situation where someone might have an allergic response to one of the ingredients within the vaccine. For the rest of us, all the millions of the rest of us, when we receive the vaccine, what we end up with is a sore arm. Many of us have a headache. Some of us get a fever. Most of us have muscle pain and joint aches and fatigue. And that usually lasts for about a day or 48 hours, and then you recover. I know for myself, I've certainly experienced all of these. Next. This graph is based on the 80 million cases of COVID vaccine that have been seen in the United States over the last year. And what it shows is the number of people who have been catching COVID-19 for people who've received the different vaccines as well as unvaccinated people. So you can see here in the fall, there's been this surge. And for people in the green, which is Moderna, blue, which is Pfizer, and Janssen is the orange, you can see there was a small rise in the number of people who caught the coronavirus. The black tracks the numbers for the unvaccinated. And as you can see, the number of cases occurring in unvaccinated individuals is very high, which is why we have been so focused on people taking the vaccine, because really the big surge that's occurred here in the last 4 or 5 months with the Delta virus has been in unvaccinated people. And these are the data that demonstrate that. Next slide. These are some more of the same data. And here, rather than this is being involved with who catches the virus, this graph shows who dies from the virus. So this is an incidence of death per 100,000 people. And you can see once again, the numbers of folks who die who've received the Moderna vaccine in green, the Pfizer vaccine in blue, the Janssen vaccine in orange is very low. The incidences for the Pfizer and Moderna is well below 2 cases per 100,000, and Janssen maybe 3 per 100,000. And you can see here the incidence of death for those that are unvaccinated approaches 20 per 100,000. So that's about 10 times, actually the math works out, it's 14 times higher in risk of death for people who have not been vaccinated. Of course, all the other things we know about catching coronavirus and the danger of it also hold true and are not captured by this graph. And those are that those patients who have underlying health problems, things like hypertension or diabetes or chronic lung disease or chronic heart disease or chronic kidney disease, are all at very dramatically higher risk for getting sick, being hospitalized, and or possibly dying from COVID infection. And for the vaccines are helpful for this group of patients, but that's not captured in this particular graph. I mean, this is sort of all comers, but it really illustrates the importance of vaccination. Next. So the current vaccine recommendations: vaccine boosters for all adults, that's everybody over age 18. If you received a Johnson & Johnson, the second dose of Johnson & Johnson would be after 2 months. So at 2 months or longer, it's recommended that you get a booster. If you received Pfizer or Moderna, it's after 6 months after you've received that second dose. What vaccine should you receive as a booster? We don't specify. So the CDC and medical professional organizations, any of the 3 vaccines is okay. What it really comes down to is what is available in the location where you're receiving vaccines, because the transportation and storage of these vaccines is challenging, and they need to be maintained at super cold temperatures, et cetera. And so the vaccine that is available to you for the booster is the vaccine you should really get. Vaccines for children starting at age 5. So the data that support both the safety and effectiveness of vaccination was published in the New England Journal of Medicine about 6 weeks ago for vaccinations for children. And of course, children, I think, as many of us know, have not seen as much serious illness from COVID, but they still have. And there's also a risk of very severe complications from COVID that children have that adults don't. And I'm going to talk a little more of that later about that a little bit later in the talk. But there's a number of other things that are really important about vaccination of children. And one of the first ones is the safety of adults in the community who are vulnerable, people who have chronic disease. And we all know that infectious disease circulates in children, and children are a potential vector or transmitter of infectious disease. And so vaccinating our children is part of making things safe for the whole community. Another important issue is keeping our schools free of COVID, which is essential to a healthy life for all members of the community and a healthy economy. And then the last bullet here is vaccines for women who are pregnant or breastfeeding. So early in our vaccination efforts, it really wasn't clear what the data were for pregnant women and breastfeeding women. When I spoke to you over the noon hour back in December of last year, these were unknown things, but they're not unknown anymore. At this point, as I mentioned, there are many, many millions of people who've contracted COVID, and there's also many hundreds of millions, even billions of people who've received these vaccines. And this is what these are the data that we've come to know, are that women who are pregnant and women who are breastfeeding have an increased risk of complications and illness from COVID-19. They get sicker and they have more problems. And in addition, another thing we know that happens from COVID-19 is that it does cause pregnancy. It is associated with pregnancy complications and pregnancy loss, miscarriage, and other complications of pregnancy, higher rates of cesarean delivery, higher rates of preeclampsia. So the other thing that we know is that vaccination has been safe. For women who've been receiving the vaccines, they do not have higher incidences of any complications from the vaccines, higher incidence of side effects. So the Center for Disease Control, the American College of Obstetricians and Gynecologists, which is the leading professional organization for physicians who care for women who are pregnant, recommend that all pregnant women and breastfeeding women get vaccinated. Next. Efficacy. How well do these vaccines work? So I'm including this because actually it just was published last week in the New England Journal of Medicine. These are the data for the messenger RNA vaccines for the first 6 months. So as you know, the vaccines have been out now for 11 months. We started vaccinating back at Christmas time last year. But the data from millions of people has been collected, analyzed now for the first half of that year, the first 6 of those 11 months. And the data show that the vaccines are 91% effective at preventing disease at 6 months and 97% effective at preventing severe disease. This has been borne out in the other data that I showed you earlier that showed how the people who are getting sick are people who are not vaccinated. Now, what is this crazy graph here? Let me just take a moment. So on the left to right is time in days. So there's 2 groups of people, and one group of people received, I'm sorry, there's a phone that went off. There's one group of people who received the vaccine, and those are shown in red. And the other group of people received a placebo, which is, it's not a vaccine, it's just a shot that they received of salt water. There's no medicine in it. And as you walk from left to right on this graph, the people who did not receive the vaccine some of them are catching COVID. And so you can see the levels are rising in terms of the number of COVID infections. But you'll see that the number of infections that are occurring in the people who got the shot, which is red, it doesn't go up. It stays relatively flat. And that's because that group of people is not getting sick. So this is a very scientific presentation of the data that was just published this last week, which confirms the effectiveness of the vaccines that we've been giving. Next. Our vaccination rates in Southeast Alaska are excellent. And here you can see in Juneau, 80% of the folks in Juneau have received at least one shot. And in Sitka, similarly, Prince of Wales, over 60%, Haines over 70, and Wrangell, about 60. Now, ideally, I would like all of these folks to get their second shot, and if they are eligible, to get a booster. But at least we've got this percentage of people that have received at least one shot. And I would ask that all of you encourage your family and neighbors and friends to follow through with complete vaccination, for not only for their own health, but for the health of our communities. Next. These are some numbers that show fully vaccinated numbers by location in some of our smaller communities that SEARHC provides care. And what you'll see there is Angoon has been doing really a fabulous job. They have the highest percentage of their community vaccinated with 2 shots of any community in the state, and of any community in the region. And you can see others of our smaller communities are doing pretty good in terms of having approaching 50% of their community being fully vaccinated. And I would like to encourage anybody who is listening today who's from these communities to I applaud your communities for the hard work that you've done, and I encourage you to continue moving forward with this. Next. A lot of information in the news, a lot of news stories in the last week about the Omicron variant of COVID-19. Really not a lot of information available, not a lot of changing information available. What we know at this point is that there is a variant of COVID-19 that's emerged in South Africa. It's been identified, but it's also been identified in South America and in Japan. And no cases have been identified in the United States, although given patterns of air travel and et cetera, I believe it's only a matter of time, certainly within the next week, before we'll see some cases in the US. The information that's available so far is that it's more transmissible than the Delta virus. It means it's easier for it to pass from one person to another. But we really don't have good data on how effective the vaccines are. There's preliminary data out of Israel that show the vaccines are effective. Of course, we hope and expect that they will be effective, but how effective is yet to be seen. Next. Actually, if you can go back, I'll just say, for those of you that might spend time on the internet looking at things from the State Department of Health and Dr. Ann Zink, who's the Chief Medical Officer for the state of Alaska, she's had a number of really excellent updates on the Omicron variant in the last several days, which in greater detail cover the information that I just discussed. Next. the Omicron variant, and what is a variant and what does that mean? In this slide, you can see a schematic of the coronavirus, again, with these little yellow spikes on the outside, which are referred to as the spike protein. Why is that important? It's important because this is the protein that hooks onto a person's cell when the virus is moving into the body. So it's sort of like the key that opens the door for the virus to get into the cells of the person who's being infected. And it's also, as you recall from what I was saying earlier, it's also the thing that that our immune system recognizes when our antibodies attack the coronavirus to make us immune or safe. So the spike protein is very important. And this is a schematic drawing of all of the different pieces of that spike protein in the genetic material of the virus. And so when these viruses are replicating inside of patients millions and millions and millions of times, what can happen is that there's a change in one of the little pieces of information that can happen just by accident. And sometimes that change will create a new version of the spike protein. And that's really what's happened here. Next. I'd like to move on to the issue of post-COVID conditions or long COVID. And these are data that were presented just this summer in an article by a physician from the Mayo Clinic that was published in the Journal of the American College of Cardiology. So the incidence of symptoms occurring following an infection with COVID, for those people who catch COVID, somewhere between 30 and 98%, 33% and 98% of those people are going to have some symptoms for about a month. About 13% will have symptoms extending from 1 to 2 months. About 4.5% of those people will have symptoms extending from 2 to 3 months. And a small but still significant number of people, about 3%, will have symptoms greater than 90 days or greater than 3 months after the infection. I think when you consider how many millions of people have contracted COVID, that 3% turns into hundreds of thousands of people that are experiencing symptoms greater than 90 days out from being infected. And to tie this into some of the things I've been talking about, this is a really important reason to get vaccinated. You know, the number of people who actually die from the coronavirus, thank God, it's not really high. It's still high enough to be catastrophic for those patients and for their families and for our communities. But you know, there's many people who say, "Oh, well, you know, I don't really want to get vaccinated because I'd like to have natural immunity, and really, you know, it's just like having the cold." Well, there's two things I have to say. The first is we now know that natural immunity is nowhere near as high as the immunity produced by the vaccines. So if you've had COVID before, along with all of my physician colleagues, we recommend that you get vaccinated because you're going to have much higher levels of immunity from the vaccine than you'll ever get from having had actually the illness. And then these numbers point out the fact that this is not an easy deal. This is not a benign situation. Catching COVID, you can end up with long-term side effects, and you don't want that. You know, having a few side effects for a day or for 48 hours, a sore arm and some muscle aches is nothing compared to months and months of misery. Next slide. In the first 30 days, these are the rates of these particular issues. And you can see almost 90% of everybody has headaches for a month. Fatigue, and this can be severe fatigue. Almost everybody has fatigue lasting for a month. Altered sense of smell and taste. This is miserable. To not be able to taste your food is really, really a very, very a difficult thing. Shortness of breath, very common. Cough, less so. Chest pain, less common. Anxiety and depression, well, 15 to 23%, and that's really that can be very, very significant. Next slide. Post-COVID conditions, long COVID, all of these symptoms have been identified by researchers, by the Center for Disease Control, as being the kinds of symptoms that people do experience. That group of people I was talking about who have symptoms longer than 3 months, longer than 90 days. Those kinds of symptoms include these things: diarrhea, mood changes, heart palpitations, brain fog or difficulty concentrating, fatigue. So these are all very significant problems. And you'll notice I say the ADA, the Americans with Disabilities Act. So in the last month, the federal government has added these symptoms within the context of COVID infections to the problems that are recognized under the ADA. Next. The next post-COVID condition I'd like to talk about is multi-system inflammatory syndrome. This is an uncommon problem that affects children primarily. It has been identified in adults, but very, very rare. The median age that this occurs in children is at 9 years. More than half of the people who contract this are male. More than half are Black or Latino. It has been reported in American Indian and Alaska Natives at much lower rates than Black and Latino and Caucasian. It's uncommon. There have been 5,500 cases reported in the United States. There's well over 5 million cases of COVID reported in children in the US. So it works out to about 1 in 1,000. There have been 48 deaths reported in the US from this. And this is a serious long-term consequence of COVID infection, which occurs primarily in adolescent and school-age children. Next. And the symptoms of that are persistent fever, bloodshot eyes, abdominal pain, diarrhea, skin rash, and it can lead to life-threatening cardiac issues. It's probably one of the most significant long-term consequences of COVID infection. Thankfully rare. Next. This is the data which associate the multi-system inflammatory syndrome with COVID. So, and I'm including this because it's actually really, it shows how scientists know these things and come up with these things. And how do we know that this is caused by COVID? Well, what we know is that there's an extremely strong association. So the black line here represents the number of cases of COVID-19 occurring in the country everywhere. And the blue line represents the total number of the multi-system inflammatory syndrome cases occurring in the country everywhere. And you'll see as you go across through time, as the number of COVID cases goes up, the number of MIS cases goes up. As the number of COVID cases goes down, the number of MIS cases goes down. Now, we scientifically have yet to connect the dots between that causation of COVID-19 and this syndrome, but it's very clear that it is occurring in children who have COVID-19. And as the amount of COVID that happens in the country goes up, the amount of this problem that we see goes up. So a pretty clear connection between the two. Next. So what is a person to do? What should I do? What should my family do? What should you do? I think there's, we will continue to work in the medical scientific community diligently to stay ahead of this and of these problems. There's really excellent cooperation and collaboration amongst the scientific community across the globe to stay ahead of whatever the virus is throwing at us. But the real issue ultimately comes down to all of us in terms of our own personal responsibility for stopping the spread of disease and stopping the spread of the virus. Getting vaccinated and receiving that booster dose is important. It is the very best thing that we have to prevent COVID and prevent its spread in our community. You saw the graph I showed, the difference between this being diagnosed or caught, as well as dying from it, between those who are vaccinated and those who are not. Wash your hands frequently. It's a simple thing. It's been proven scientifically to make a big difference in terms of helping to keep yourself safe, and avoid touching your face. And we talk in medicine, we talk about the T area, your nose, your mouth, your eyes, your eyelids. So washing your hands frequently, doing your best. We all unconsciously touch our face. I know I've done it a number of times here in the last 30 minutes. It's a natural human thing to do, but it's important for us to wash our hands and avoid that as best we can. And then wear a mask. And of course, I'm just as tired of wearing masks as you are, but it is scientifically demonstrated to reduce the transmission of COVID-19 and other viruses as well. So next. Thank you, President Peterson. That's my presentation, and hope that we can talk about any or all of it.
Absolutely, and thank you again, Dr. Bruhl. And one of the things I'm impressed with the information is, social media and just across the country, you see a lot of division and different beliefs and misinformation. And we're not here to share political views or anything like this. This is really getting down to the real science of it, real facts. And so I really appreciate that, because I think at times you can kind of become part of the problem by fueling disinformation and a lot of social media experts, I call them, who got their doctorates from reading Facebook until 2 in.the morning. But I really appreciate, you breaking it down the way you have. And one of the things I fear is, at what level, this is my own question, what percentage of each in the communities do we need to get vaccinated? I saw Angoon, man, I was really proud to see Angoon's number was over 80%, but you see some down at 50%. Where do we need to be?
Well, the experts in this area of epidemiology say that it's, for this virus, it's somewhere between 70 and 80%. based on the effectiveness of the existing vaccine, as well as how transmissible the virus is. More is better, but certainly if as a country we're able to approach that 80% rate, the prognosis is good. I mean, that's the technical answer. I think the geopolitical answer is as high a rate as we can in these countries that have very large populations and very low levels of vaccination. So South Africa, the vaccination rate in South Africa is about 25%. And so I think the countries that have the vaccine available to share it with these very highly populous countries that are poorly vaccinated are well served to do that, because it helps to prevent the emergence of variants, and so yeah, hope that answered your question.
You bet. I'm gonna go ahead and turn to some questions from our viewers. From Kathy Lawrence. Once a person has had COVID and recovered, does this go on the COVID-19 vaccination record card, and who signs it?
Currently, there is no crossover between people having a history of contracting COVID and the vaccine record card. There are a number of jurisdictions administratively where it's required to either show a vaccine card or to have had documented infection previously. So my recommendation would be, if you need to be able to document that either for work or for crossing the Canadian border or whatever it might be, that you obtain a copy of your test result. And if you were tested at SEARHC, it's certainly a very straightforward matter to get a copy of that test result. You can get it on your patient portal on your phone if you have a smartphone, or you can request a copy directly from our medical records. And I think the same would be true of any other healthcare organization.
Right. So, Dr. Bruhl, I'm going to paraphrase this one a little bit, summarize it. From Dermot Howard, has been raising multiple grandchildren, and since last summer, some have contracted the virus while around each other and some don't. Time goes by, another one gets it, the rest don't. So just wondering, why are some testing negative and some are positive?
Yes. Well, there's certain viruses that are out there, and chickenpox is an example, that if susceptible people are exposed, they're going to catch it. I mean, it's almost, if you take a gymnasium at a basketball game and somebody's in that gym with the chickenpox virus, somebody has active chickenpox in that gym, somebody else is susceptible to chickenpox in that gymnasium, I think the number is, it's like a 90% within 5 minutes. It is so highly infectious. So the coronavirus, thank God, is not that infectious. And so exposure does not necessarily translate into disease for everybody. So that's kind of the view from 10,000 feet up, but that's just the reality. Not everybody who's exposed gets it. Now, the other thing is, not everybody who gets it gets very ill. Some people get deathly ill very quickly, and some people have such a mild experience of it that the only thing that they notice is maybe like a little bit of a runny nose, like with a cold. And so a lot of people who have mild symptoms don't ever go get tested. And as a result of that, there's a lot of, we suspect there's an awful lot of positive cases that we never diagnose. If, as a purely practical matter, you got a house full of kids and you want to keep everybody as healthy as possible and keep everyone going to school and moving forward, I recommend you get, if they're over 5, you get them vaccinated. It's free, it's available, it's safe, and it's effective.
Absolutely. From Marjorie Elizabeth, I am in my PhD program in health science, global health. I find it difficult to find data for Indigenous people across the nation with COVID-19, or do you think the data for Indigenous people is being collected accordingly?
Oh, what a great question, and what a horrible problem. The work that you're doing and that you'll do once you finish your PhD, if this is an area of interest, the work that you're doing is essential to the future care of Indigenous people. There is data being collected currently with both vaccination and the incidence of disease for both American Indians and Alaska Natives, but there's not a lot of research that's being done that includes Alaska Natives or Indigenous people, and there's lots of reasons for that, which I'm sure you're aware of. Part of it is the inherent bias of scientists and people who in the medical profession who traditionally have been people from the dominant culture, Caucasian and male. And so research in medical research that includes women and children, and medical research that includes Indigenous people has been poor in terms of that focus. As a matter of fact, I was recently evaluating a potential research study for our organization from a professor that wanted to request the possibility, and we have a very detailed review process that goes on for that. And the statistic that was cited was that for behavioral health problems, and here we're talking about things like depression, anxiety, mental health issues like schizophrenia, etc., that in the entire period from 1980 through 1995, that there was no published peer scientific study that included Indigenous people as a separate study group. And it's just shocking, and it's those kinds of statistics, but yeah, they're there. Could go on about that for a long time. The flip side of it, of course, is that for some very good reasons, there's a lack of trust between many Indigenous communities and the medical establishment that's based on things that have occurred with the IHS over the years, as well as other healthcare organizations that have mistreated, undertreated, ignored, or abused Indigenous people as part of the medical establishment. And as a result, when researchers approach communities to include them in research, there can be a lot of skepticism and reluctance to participate. And I do know that did occur a couple of years ago when these vaccines were being developed, and there were efforts, some efforts that were not successful in terms of enrolling large numbers of Indigenous people. And it makes good sense. but it's still a barrier. It's a challenge that is going to take us a long time to overcome.
Yeah. I know we're getting near the end of our hour, and I'll take another question or two, but for those that we don't get to, Dr. Bruhl, I assume we can work with you to get those answered and provide those comments. Great. From Tehona James, her question, but get the same booster as the original vaccine you received, right? Don't mix vaccines is what I was told.
What you were told is the ideal. It's ideal for people to get the same vaccine that they got their initial series. However, given the complexities as well as an analysis of the data have shown that getting a booster, regardless of the vaccine you receive, is very helpful. And so the CDC has removed that recommendation. And at present, the CDC says that if you received Pfizer, it's preferable for you to have a Pfizer booster, but not required. You could get a booster with Moderna or even with J&J.
Okay. Her follow-up question was for mothers breastfeeding. Do they pass that down to the antibodies down to the baby?
All antibodies are shared with the baby. The vaccine does not cross into the breast milk, but the antibodies that the mother produces will be excreted in the milk, just like antibodies to any virus or any infectious agent. So yeah.
Great. Well, thank you so much again. I know we ran out of time to get to everybody's. There's some great questions, and I think this is every time I'm really impressed with the questions we get. Our folks are really paying attention and trying to get this information and make smart choices, and I congratulate them for that. And again, Dr. Bruhl, you'll have my forever gratitude for helping us have the information to make informed decisions. As a tribal leader, as a tribal citizen, I'm incredibly proud of our health, our native health system here in Alaska. We've been kind of leading the nation, I think, and getting our people vaccinated, getting the information, being available for testing has been phenomenal. I just can't tell you how much I appreciate all that SEARHC and our other native health providers in Alaska are doing. And I think we're fortunate to have your expertise and, voice in this.
Well, President Peterson, it's an honor and a pleasure, and I look forward to getting back together again in the future.
Great. Thank you so much. Well, that concludes this week's Lunchtime Chat. We are trying to get back on a weekly schedule for our Lunchtime Chats. Thanks for everybody's patience. This week's door prize winners are Tina Cato won a hydro flask, Rob Sanderson won a t-shirt. If you message us with your address, we'll get those sent out to you right away. Thank you all very much. And again, just be safe and be informed and wear your mask. So thanks again, Dr. Bruhl. Much gratitude.
Yep, good night, Chief.
Be well.